I think people assume that it was the pandemic that created the shortage of veterinarians, but it was actually starting before the pandemic. That certainly was a tipping point, but the increased demand for veterinary services has been growing for quite a long time, and it's across the profession. It might be felt most acutely in certain parts of the country and in certain parts of the state. It might be felt most acutely in some of the rural areas, but it's across the profession. So this workforce shortage is not limited to any one particular geographic area or to any particular species. So we are still seeing increased wait times for certain kinds of services, especially for emergency services for small animal, companion animal patients. And that has continued beyond the pandemic. I would say the factors that have driven the shortage are the increased demand for veterinary services. And because veterinarians can practice on multiple species, an increased demand in one part of the profession can drive the shortage across the profession. When there's an increased demand for veterinary services with pets, increased pet ownership and an increased demand for veterinary services with existing pets, that pulls the demand away from food animal. Yeah, the impact of the veterinary workforce shortage really does threaten the health of not only animals but people, because veterinarians protect the health of animals, people, and the environment that we share. Animals are really important to the health of people. They improve our health both through the human-animal bond, but obviously many people eat meat, and meat comes from animals. There are diseases that are shared between people and animals. Those are called zoonotic diseases, and veterinarians help protect the health of people through protecting the health of animals. We've got a lot going on, so we are training the next generation of veterinarians, we are training the next generation of biomedical scientists, and we are training the next generation of veterinary specialists. So that does keep our faculty very busy, for sure. Our veterinary class size has expanded through our partnership with South Dakota State University. We just transferred the first class of 20 students from Brookings to St. Paul this fall, and so that increases our class size by 20 students. So we'll graduate 125 students in the spring of 2025. Yes, the partnership with South Dakota does increase our emphasis on training rural and food animal and mixed animal practitioner. We also have a program that's been in place for quite a number of years called VetFast, and that stands for Food Animal Scholars Track. And so that is a program that's geared specifically at recruiting high ability students who are interested in the food animal practice, and that's been very successful. We have been able to recruit and train and mentor students who are going to go out into food animal practice through that program. Veterinary loan repayment programs are a really important piece of the equation, and that's because student debt is a big challenge in our profession. Training health professionals is expensive, whether that be physicians, nurses, dentists, or veterinarians. And so loan repayment programs, especially to recruit and retain students in rural practices, graduates in rural practices, is a really important piece of the equation. Veterinary medicine is an absolutely wonderful profession, and so I do very much encourage young people to consider it. I think one of the things that young people don't realize, or that everyone doesn't realize about this profession, is just how broad it is. There are so many different ways that a veterinarian contributes to the health of animals, people, and the environment we share.